Hello, everyone, and welcome. In this part of our summit, we have Dr. Stephanie Canestraro, or as you like to go by, Dr. Steph. Dr. Steph is a trained chiropractic doctor. We met through our, working life, and what's unique about you is you've sort of found this niche where you actually treat both with functional medicine, which we'll talk a little bit about, and structural practice, like most chiropractors. I think the majority of your practice is professional athletes, so NHL players, NFL players, maybe their families, but you found this way to really influence them to make sure that they're playing at their best level. I think we've talked before, a lot of times people work with you and they have career years because their performance just goes up. But today, actually, what I wanted to learn from you is your clinic's called the Vagus Clinic, and you talk a lot about this thing called the vagal nerve and how working on the vagal nerve can help with stress and anxiety. And I think what a lot of trainers are feeling themselves, but also probably getting from their clients, is there's an overwhelming amount of stress and anxiety right now with what we're going through.
Mm-hmm.
And from what we were speaking about, I think there's certain things that we can give these trainers to give to their clients to work on this vagus nerve,
Yeah.
to really calm and bring stress down, bring anxiety down. And there's simple exercises that we can do at home, or I don't know if exercise is the right term.
Different
So
techniques, just
yeah.
different things you can do at home. Yeah.
So why don't you give a little bit about who you are and how you went from being like a chiropractor doing adjustments to finding this vagus nerve, and how that's really influenced your player population. Because I think them hearing it at the highest level might make it easier to understand at everyone else's level.
Okay. So, well, as you mentioned, my name's Dr. Stephanie Canestraro. I'm a chiropractor by trade, but through my own experiences with my health, I ended up in the functional medicine field. And I ended up naming my clinic Vagus Clinic because I actually got really sick, and it started with gastrointestinal symptoms, but then it slowly and then quickly declined into neurological symptoms, which were very scary and very persistent. So I was in and out of the hospital with very strange symptoms leading from feeling like I was having a stroke to acute pancreatitis. Like, it was just like very, very scary time. And so going through the conventional medicine system, I wasn't finding any answers. And so that's how I ended up finding functional medicine. And it's become a huge passion of mine and part of my life to try and help people get past their kind of scary chronic issues that are going on. But I think in retrospect, when I was looking back and I was naming or trying to come up with a clinic name, because I wanted it not to just be my name, I wanted it to be able to grow. And I was thinking, okay, what really happened to me? And I was thinking, I was just reading all of these symptoms about the vagus nerve, and I had almost all of them. When your vagus nerve isn't functioning properly, you're too much in your sympathetic nervous system, which is your fight or flight nervous system. And when you're chronically in that state, which most of us are right now, then you can end up having very strange symptoms. So I want to share with you guys today ways that now, even if I'm having issues where I'm having too much anxiety in the day, or I can't shut my mind down, or I can feel my heart racing, which are all symptoms of too much of this fight or flight nervous system, as opposed to our vagus nerve, which is our rest and digest side of our nervous system.
Mm-hmm.
So there are little techniques that I've used on myself, and through experience, they've helped me calm myself down, even in times where I felt like I was going into having a panic attack. Like, I used to get those feelings in confined spaces, which I never had in the past. I had never had any sort of claustrophobia. But after my brain was kind of breaking down because of all the symptoms that I had with my gut, and I'll explain the gut brain connection and how the vagus nerve actually starts in your brain and innervates your entire intestinal tract, and the health of your intestinal tract dictates the way that you feel in your brain. It's a bi-directional kind of highway. So, and that's where we get the kind of gut feelings. People are like, oh, I had a gut feeling. Like, your brain is very connected to your gut. But, when you're going through panic attacks, when your gut's unhealthy, that's not like a true gut feeling. That is your gut is actually a mess and kind of and then your brain is getting that information from the vagus nerve, because it's like a highway in between those two organs, but also a lot of your other organs, including your heart, and kidneys, pancreas.
So it basically connects everything.
Yeah, like everything. It stops at the transverse colon. So our colon, the end of our colon is the descending colon, and that's your and then it's your rectum, and that's where your feces comes out of. The vagus nerve innervates up until the transverse colon, so it does all of the organs above there, and it literally has a hand in almost everything, including our immune function, how healthy that we are in general. And there's ways we can test it. So a simple thing that I have gotten a lot of my athletes, and this is something you have to purchase, but it's a very affordable, and I think that there's a lot of value in it. And it's just a heart rate variability monitor. And to get this done professionally, it's, quite a process, and, that is more on the ball with the readings that you get. But this is just something you plug into your phone. And I've bought, like, I don't know how many of these, and I end up giving them away to all my patients, but it's heart math, and it's called Inner Balance. And so you plug it into your phone and you attach an electrode to your ear. And I mentioned the vagus nerve innervates all of your organs, including your heart. So your heart rate variability is what this little sensor is measuring. And your heart rate variability is essentially not just the rate your heart is pumping, but the difference in frequency in between the pumps. So a way that I kind of explain it, and it's not like 100% relatable, but it makes sense to people, is if you go to the gym every day and you're doing half of a bicep curl, like, we know that's not healthy for the bicep muscle, right? We know that it's only going to be strong in that range. Well, the same thing for our heart. We want it to be going through a lot of different ranges. And the more variable your heart is, the better vagal tone you have.
So you want a high heart rate variability.
Yeah, that's called coherence.
Okay.
Low heart rate variability is associated with almost every chronic disease. People who have low heart rate variability have a higher chance of dying from diseases. And so we have this whole virus epidemic, and the people that are losing their lives to it probably have a low heart rate variability. So if you can start working on that now, it has a huge impact, not only on controlling your anxiety in the moment, but also in your long-term
overall health.
Yeah.
So you would get this monitor, and this could be a good indicator of how healthy your heart is. Now, is this something that trainers can you walk us through this so that trainers can learn to do it on themselves, but then are they able to easily give this to their clients?
They can put it on their clients and show them, and then they can decide if they want to get the actual product. But it gives you biofeedback almost. Like, it'll be like you're in the red zone, or you're in the yellow zone, or you're in the green zone.
And what zone do you want to be in? The green zone?
You want to be in the green. Green means that you're in coherence. So that coherence is that really highly variable heart rate, which is good for your nervous system.
Okay, so let's say we do this heart rate variability. It comes back and it's a yellow red. What are some lifestyle exercises or what are some techniques that trainers could start to give their clients to improve their vagal nerve health and to actually get that heart rate variability into the green?
Yeah. So one of the things that actual app will cue you to do, and that's deep breathing. So people talk about breathing all the time. We hear about meditation a lot. And you can actually see through the feedback that if you take a deep breath in, so you take a 5-second deep breath in, and then you hold your breath for 4 seconds and you breathe out slowly. After that breath, you'll see it goes green for a little bit. And then you can start to train your body to do that. If you do 10 breaths like that, you can get longer amounts of time in coherence. So when you're actually using that app, it will show you the amount of time that you're in the green, right?
Okay.
And as you practice with your breath, you'll see that you can, just from breathing differently, you can get yourself into coherence. But another thing that I've done, and I ended up doing this, I'm trained in acupuncture. And so I was on a flight one time and I was starting to feel that panic come on. because of like the claustrophobia or whatever it is that just triggers it. Like
Yep.
1 second I'm fine, and then it just starts to like spiral. So what I did have in my purse were, I always have toothpicks, like these
Okay.
toothpicks. And since I'm trained in acupuncture, and I was like, I started to poke like this, the points that I know are powerful relaxation acupuncture points.
So you don't have to actually pierce the skin.
No, it's like pseudo acupuncture.
So where would be like 3 or 4 points that,
So I'm going to show you that now. So this
okay.
is
And you
one.
can also just use your thumb, right? Like you can actually do acupressure. Is it the same thing?
Yeah, you can do acupressure, but I'll tell you that this was much more, because I mean, I've done that, and I sit there and I squeeze it, and you can squeeze it, but there's something about
The fine point.
the fine point
Yeah.
that really, and I have had it where I'm wearing the heart math monitor and I'm doing this, and so I'm going to show you points that were powerful, because
Okay.
right
I got a
here,
pen.
yeah, right here is a really powerful point, like right in the web of your hand. This is a very powerful acupuncture point. And
Okay.
so lots of people know about this one for headaches and stuff, but it's also one of your control points for lowering
So
sympathetic.
we just want to be jabbing it. Is there any amount of time or just,
No, I just do it, and like, I don't know why this is how it is, even when you're treating people. It's like the most tender point that you find
is
is
the best point?
the best point. So you
Okay.
kind of like, so I'm doing that, and like people were watching me on the plane probably thinking I'm crazy, because the next part I did was I'm like poke in like this
Well,
like,
look, everyone now is at home, so I think it's good that trainers can show this to their clients and be like,
mm,
look, you're at home now, but if you're feeling bouts of stress, like these are good tools.
yeah. So another thing is the vagus nerve runs like down like this, right? It's running along with your carotid artery.
Okay.
And so I literally would start poking just down here with the toothpick. And like even right now, like I'm feeling more calm just from doing this. And then another thing, your vagus nerve innervates the tragus of your ear, which is right here. It innervates here, and then
I'm wondering if that's why for migraine they tell you to
yeah,
get that pierced.
yeah. But so you can tap your ear with the toothpick, and you can tap the tragus. And I'm telling you, even doing this right now, like I can feel my body kind of calm down.
Okay, so the first tool, just to summarize, is deep breaths. And I think you're saying like box breathing, I think is what it's called. So you do like 4 or 5 seconds in, hold for 4 or 5 seconds, and then let out 4 or 5 seconds and keep. So that's very easy, I think, for trainers to start implementing with their clients. And then this is something as simple as a toothpick. And so just the top 3 or 4 points, the webbing of the hand,
Webbing of the hand,
both
uh,
hands.
both hands.
Okay.
The along your, this is called your clavicle or collarbone.
Yep.
Anywhere along your collarbone or clavicle, I should have had you get a toothpick, because you would feel that it actually is.
I don't have one.
I know. So along here, and you can't hurt yourself, but I'm poking pretty hard. And then in your ear,
Yeah.
okay, and then even just down the neck like this in a line.
Okay. So like this.
Yeah.
Okay, cool.
So that's one thing, and I'm telling you that it's brought me down from like literally on the verge of having like a panic attack, which I don't have them often, but they're awful for anyone who
Is
has.
there anything else, like a third little tool or technique that we could do?
Oh yeah. So I mean, I have a whole bunch of different. So any work on your scalp is hugely, like, so all of your cranial nerves, or 3 of your cranial nerves come from the same spot on the brainstem as the vagus nerve.
Okay.
So another really powerful one, and so you can test your own vagus nerve and see if there's an issue by doing, when the doctor looks in your mouth, pushes your tongue down with the tongue depressor,
Yeah.
and says, say
Yeah.
so actually the proper way to do it is you hold your tongue down and you're going ah 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 ah, so you're saying it over and over again. Even just doing that stimulates your vagus nerve. Or
Gargling
gagging,
water, maybe.
yeah, gagging, gargling, or making those humming, or making that ah 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 sound.
Okay.
So so when you're assessing your own vagus nerve, if anyone is interested and wants to do that, you can just use clean your hands, push down on your tongue, and you're going to say, like, you can use the light from your phone, or usually if you're in your washroom, it's okay, you'll be able to see, and you're going to go and both sides of your it's called your palate, the soft tissue at the back of your
Yeah.
throat, and that little hangy thing
Yeah,
that
yeah, yeah, yeah.
yeah, it's called the uvula. It should they should both sides of your palate should rise when you say ah, but sometimes one side can be more paralyzed, and you don't even have to do this. Just gargling and gagging is going to help it. But if you are interested and you do that and you notice there's a difference, there's an exercise that I'm going to show you now that so that's what I would do to someone,
To assess.
to assess. Yeah. And
Okay.
especially if someone has some sort of head injury or kind of chronic disease, that's one of the ways, other than heart rate variability, that I have access to see how your vagus nerve is doing, essentially.
Okay. Yeah.
And so then what I do is I have people, so you link your hands together like this. You're lying down is the best way, but we'll do it sitting up. And then you're putting a little bit of pressure on the base of your skull, which is your suboccipital.
Yep.
Not a lot though, just you're like, when you're lying down, your thumbs are just against what are called your suboccipitals, and there's a little bit of pressure.
Yeah, I feel
And
it.
what you do is gently, not straining your eyes too much, you look all the way to the right.
Okay.
And you hold this for 10 to 30 seconds until you start to feel your heart calming down. Okay? Some people yawn, some people sigh, some people it takes longer or they have to practice. And then you look to the center, and then you're going to keep your head straight and look all the way to the opposite side.
Oh, I found one side way harder.
Now, what this does, it's almost like fascial work for your vagus nerve. The eye, we're not used to straining our eyes those way, and it pulls throughout your brain on fascia all the way to the back of your skull, essentially.
So, yeah.
And if you do that for someone and they can find it harder on one side, and then you retest their vagus nerve, oftentimes it's rebalanced again, or their heart rate variability is better.
So let's say most trainers now watching this, we don't know how long we're going to be not able to see people in person. So let's say if, I wanted to call one of my clients, see how they're doing, and they're telling me that they're doing okay, but they're having a lot of stress. And I'm like, you know what? I have a perfect routine for you to do.
Yeah.
Would this be an okay routine to give to anyone? Like, let's say I want you to do 10 sets of box breathing, which is what we just spoke about, the 5 seconds in, hold. I want you to do I want you to get a toothpick, and I want you to do 30 seconds per point, let's just say, just to make up a number. And then I want you to do maybe 3 sets of this where you hold for 30 seconds, hold. Is there any chance of, like, that's fine for anyone to do?
No, that's safe, because like I said, we're not overly straining your eyes. You're just looking gently to one side. Like, it's completely safe. And people just feel better from it. Like,
I think this would be a good thing to incorporate. Now, can we do this? Should this be done outside of training, or would this be good as a pre-workout?
This is good. Okay, so this is something that I want players to do before, because there are always way too much in your sympathetic nervous system. And when you are more kind of rested and your heart rate's stronger going in, then people perform better. That can be the same for highly strung people. Like, I know right now, so say, the trainers are back at the gyms and their client comes in and they've like had a stressful day and they're like gonna start working out right away. These are great things to do.
Even people, like, we have a lot of, I think a lot of trainers are trying to do home trainings right now.
Yeah.
And I think even this is a warm-up. Like, this could be part of the warm-up now. To me, this seems like this could be done 5-10 minutes a day.
Yeah, it's really simple things.
And how many times should someone do this in a day? Like, I know everyone's a little different, but doing it once or twice a day, like before you go to bed, is
twice a day. I'd say once earlier in the day, once later.
Can you do this right before bed?
Oh yeah.
Okay.
And for people that wake up during the night,
yep,
do this to put yourself back to sleep.
Okay. So just to summarize one more time, because I think we have a good routine for people to teach their clients. Box breathing. So does it matter if the mouth is open or closed, like through your nose?
Breathe in through the nose. I'm not even picky, but breathe in through the nose. It's a thoracic abdominal breath. So it's the one where you're just trying to fill your whole lungs as much as you can. And then you hold at the bottom for at least 4 seconds, and then you're going to breathe out for longer than you breathed in for. So if you breathed in for 5 seconds, you held for 4 seconds, you want to breathe out for at least 6 seconds.
Could we do just one round? So just maybe like 5, like maybe 2 or 3 breaths, we run through this one more time and then this, just to show people what it could look like as a warm-up.
Yeah.
Okay, so what do we do first? We breathe in.
So first we breathe in.
Okay.
Hold for 4, and then no, for 5 to 6.
Wow, I already feel that's like instant.
Yeah, that
So,
one.
okay, so we start off with that, maybe do 5 or 10 sets of that.
Yeah.
And then we get a toothpick. I have a pen now, so I'll just use the end of the pen. And I go for maybe 20, 30 seconds a point. So we'll just show an example.
Mm-hmm.
And then the other hand.
Yep.
Wow, it actually works really quick. And then where my neck.
Yeah, so we'll do neck. I like to do a whole line. And then collarbone. Collarbone for me is one of the most helpful ones. Everyone's going to be different where they hold stress.
And I want to do it here in the back of my head. Is that
okay?
Oh my
gosh, okay, so like that's the thing. This for your scalp is unreal. So don't be afraid to just go everywhere, but the ear is really a key one.
I can't get to the ear. I got my head.
Yeah, you can't. But the ear,
nifty headphones.
The ear is a key one because this is the only place where the actual skin is innervated by the vagus nerve.
So, and then the last thing we do, we're lying down. Ideally, we put this on the back of our head, like right under the occipitals.
Yeah.
And I look right and I hold for, let's say, 10 seconds.
Then you look center.
How long center? Just to reset, or
look back, and then you're just to reset, and then you keep your head straight and you're looking.
Wow. Okay. I think you're going to help. I think this is great for people right now.
There's so much more that you can do. Like those are like the basics. And we talked about heart rate variability, which if people want to buy that heart math, I don't know
if they're delivering. If they're delivering now, might be a good idea.
Right now. Yeah, that's true.
But I even think,
I
even think right now, with how the things are, even if trainers just give this to their clients to do at home, again, you're saying there's no negative, this will just improve stuff.
Yeah. So, and think about it this way. If you're feeling stressed at all, you're not having good heart rate variability.
Okay. Got it. Okay, cool. Is there anything else as a final sort of send off you'd like to tell any of the trainers watching?
I mean, I hope you're having someone talk about supplements that help them stay calm, because there's
no, actually, we have no one talking about. We have someone talking about supplements. You know, the idea of it, but no one specific for calming. Is there any, like, I don't know what you can recommend, like globally, but is there anything
that? Well, I love like L-theanine. Anything that increases GABA is going to help your GABA, which is our inhibitory neurotransmitter. Okay. So the opposite of our excitatory glutamate. So, I mean, what comes to mind, and again, L-theanine is safe and really effective. And
is GABA safe?
GABA, like in taking the actual supplement. Yeah, but it doesn't get to the actual brain, but it does increase GABA for all of your organs. And
what about like magnesium or?
Magnesium, again, so simple. Most trainers have access to magnesium. Taking magnesium before bed is a huge benefit for your vagus nerve.
Perfect.
Those are two simple ones. So,
well, I want to thank you very much for coming on.
My pleasure.
I hope you enjoy your social isolation as much as I am right now. And yeah, thank you again. I think this is really helpful and going to help a lot of trainers and their clients out. So I appreciate it.
For doing this, Jordan.
No, my pleasure. We'll talk soon.
Okay. Bye.
Bye.